Colorectal cancer is the third most common cancer diagnosed, according to the American Cancer Society. And here at UNC Health Caldwell, we would like to encourage all those who are eligible to get a colonoscopy.
When I first noticed symptoms, I guess it would really be I started having blood passing through my stool. And I was about 17 years old. I was in high school, and I just knew something wasn't quite right. I got a phone call, and I was supposed to be going in the next day for blood work. It was pretty routine, and the assistant for the doctor that I go see, Dr. Moyes, she called me and asked me if I could come in later the same day. And I remember asking her, I said, are we just moving blood work up? Is Dr. Moyes going to be out of the office? I remember they said, we'll explain everything once you're here. So they brought me in, my wife and I were sitting there, and Dr. Moyes had told me, he said, the treatments that we were talking about previously, he said, we're not going to be able to do any of those. And he said, because they're not going to be effective because you've developed cancer in your colon. And so I remember, being, I guess, a little surprised but not shocked, just because it had already been on my mind, maybe this is what they're going to tell me. So between my consultation and the surgery itself was maybe 2 weeks. They had me up and walking the day after my surgery, and so I think I come out of surgery around 6 in the evening on a Thursday, and then by 6 in the morning they had me up and walking. But I think the recovery at home was what was difficult, just because you're, as I guess being a guy, we're independent, and people look to us and depend on us, and so it was really weird not being able to pick up my daughter and help my wife with her, and just really, I guess, feeling somewhat useless. I think that was the hardest part for me. The physical aspect of it came, with time, and I think now, several months out, I can pretty much do everything I could before. But yeah, I think the mental side of it was the hardest part for me.
Symptoms of colon cancer is if you have a sudden change in bowel habits, like the caliber of your stool gets thinner, your stool becomes ribbon-like. If you have rectal pain, abdominal pain, if you notice blood in the stool or rectal bleeding, all of those are signs of colon cancer. And especially if you feel more fatigued than you normally would or have an unexplained weight loss, it's time to come see someone.
If there are findings during the colonoscopy, let's say we find a polyp, and the polyp is within a reasonable size, we'll remove the polyp at that time. If for the unfortunate situation that we find colon cancer, then we have to take biopsies of the mass, send patients off for CAT scan imaging, and if the biopsies confirm cancer, then we refer them to an oncologist, a cancer specialist. Currently today, there are a few methods approved for screening for colorectal cancer. You can perform a yearly fecal immunohistochemistry test, or a Cologuard, which checks for fecal DNA every 3 years in your stool, or you perform your colonoscopy. The best and gold standard approach is a colonoscopy.
The fast track process for screening colonoscopy starts with an initial visit in the office at no charge to you. You'll meet with one of the medical assistants who will go through your history, go over the prep with you, which there's a couple of options for that. We can do like a tablet prep versus one that's mostly liquid, and they go through all that. They also will go ahead and give you the date and time to present to the surgery center or the OR if that's where you're having your procedure performed at.
So we do both upper endoscopies and colonoscopies. Colonoscopies are done routinely. We usually start at about age 45, even for people who are not having problems. And the idea is to try to catch problems before they become, a big issue. Certainly they're much easier to take care of before they get into an advanced state. The purpose is not just to diagnose, it's also to try to prevent colon cancers. We think most colon cancers start as a polyp. Many polyps will not cause problems, but it's impossible to predict which will and which will not, and so we usually just remove them all as a preventative measure.
Recovery after a colonoscopy is fairly quick. Patients are usually awakened after the procedure within 2 to 3 minutes. They will stay in recovery for about 30 minutes and then go home.
We use McCreary Cancer Center for a lot of different things. We use them for infusions, like if someone comes in and needs to be treated for iron deficiency anemia, and we've done all of our tests, the EGD and the colonoscopy. and there's no signs of the bleed, then we can send them up for an iron infusion. And also we've had a great relationship with them when colon cancer has been found and they need that treatment from McCrary Cancer Center. The patients will come back to us and just rave about the staff and Dr. Hawthorne up there and the services they get.
Colon cancer is an extremely preventable disease if we all get screened at the appropriate ages. Currently, the guidelines suggest that everyone should be screened by the age of 45. If you have a strong family history of colon cancer, communicate this information with your physician and you may require earlier screening.
Be okay with receiving help. I know sometimes that's hard for people to do, but sometimes, in life you can't do it all alone.